since yesterday's report. 10 of those are linked to known outbreaks and complex cases, and 5 of those are under further investigation by our public health team. There are a small number of historic corrections that Alan will speak to in just a few moments. There have been, I'm sad to say, now 771 Victorians who've passed away as a result of this global pandemic, 5 since my last report. 1 male in their 70s, 2 females in their 80s, 1 male in their 90s and 1 female in their 100s. All of these deaths are linked to aged care. Can I, on behalf of all Victorians, extend our deepest sympathies and condolences to those 5 families. There are 75 Victorians in hospital. 8 of those are receiving intensive care and 6 of those 8 are on a ventilator. A total of 2,609,485 test results have been received since the beginning of the year, with an increase of 15,741, so 15,741 results received since yesterday. That's a strong number, and I want to thank everybody who went and got tested the day before. It's a powerful contribution. I know I've said it so many times, but it is the critical point. In order to have a clear picture of how much virus is out there and what the impact of restrictions and therefore the tolerance for easing those is to make the best and most well-informed decisions, we need to have the clearest picture of the virus. If you've got symptoms, however mild, don't delay an hour, certainly don't delay days. Please go and get tested as soon as you register those symptoms. It's critically important. Turnaround time is less than 1 day, and we've got more than 200 test sites right across the state. It is critically important to us getting these rules off and getting to that COVID normal, the most complete picture of how much virus is out there. There are 4,268 cases with an unknown source. That's no change since yesterday's report. There are 73 healthcare workers who are active cases. We wish them well and we thank them and all their colleagues for the quite amazing job they do every single day. We are all very, very grateful for their care and compassion. There are 554 active cases in Victoria, so that number continues to fall. The regional picture is indeed very positive. There are 14 cases in regional local government areas under third step restrictions, so just 14 cases across active cases across regional Victoria. The rolling averages, Metro 29.4, this is as at the 22nd of September, Metro 29.4, regional 1.1. That's very important, obviously, to see that continued stability and indeed further reductions in the case numbers in regional Victoria, given the steps we've taken. Although I would make the point that whole latency issue that we've talked about a lot, the fact that it does take 2 weeks plus for you to get a really complete picture, so it's really important that all regional Victorians, whilst they have different rules to follow, there are still rules, and we would just obviously remind people that they've got to continue to follow those rules. That's how you stay open. It's only when we start to let our guard down in some ways that we can be contributing to the spread of this virus, and that of course compromises everything. In terms of the 14-day average, daily case over 14 days falling below 30 for Metro Melbourne, so down to that 29.4, as I think all Victorians and particularly Metropolitan Melburnians are very well aware, this Sunday marks a next step, provided we are in that band of 30 to 50 cases. So this shows without any doubt that our strategy is working. These numbers are coming down. We are very pleased with these numbers and very grateful for all the hard work and sacrifice and the commitment that every single Victorian is showing. You can't achieve these outcomes, you can't get to that COVID normal without an amazing effort by the vast, vast majority of Victorians, and to each of them I say thank you, and that we are very proud of the work you are doing. In terms of active cases in disability facility settings, there are 4. They are all staff members. In terms of aged care outbreaks and active cases, there are 284 active cases in aged care. I now just want to turn very quickly to some clarifications around regional Victoria and workers who live in Melbourne but need to travel to regional Victoria because, of course, businesses are now open when they previously were closed at an earlier point. So since we've moved regional Victoria to that third step, there have been some queries raised with us about whether a person who lives in Metropolitan Melbourne can travel to regional Victoria for work, including working in an industry that is operating in regional Victoria but not operating in Metropolitan Melbourne. I can confirm that people can travel to regional Victoria for work more broadly and are not bound by the permitted industries requirements in Melbourne. However, there are some conditions that do remain, and these are very, very important given the different circumstances that regional Victoria and Metropolitan Melbourne find themselves in from a virus point of view. The primary rule that if you can work from home, you must work from home remains in place, regardless of whether you're in Metropolitan Melbourne or in regional Victoria. A person travelling from Metropolitan Melbourne to regional Victoria to work must have a valid work permit. The worker permit scheme allows the employer in regional Victoria to issue a permit to a worker who lives in Metropolitan Melbourne. When a person from Metropolitan Melbourne is in regional Victoria, the Metropolitan Melbourne restrictions apply to them. Even though they're not in Metropolitan Melbourne, the rules follow them to their work in regional Victoria. For example, they can't be going out to a restaurant for dinner. They can't be engaging in that activity. They are permitted, they have a permit to go to work and then to return back to their home in Metropolitan Melbourne. This, in the main, although it won't be exclusive, but in the main, this relates to people that live quite close to the metro regional border and then work on the other side of that border. This was not so much an issue while their place of work was not open, but now that it is open, we think this is a reasonable balance. Of course, can I also make the point to anyone in those circumstances, you can't go to work if you've got symptoms, even the mildest of symptoms, or anybody in your household has got symptoms. The only thing for you to do at that point is to go and get tested and to wait for your test results to come back, which should be within a 24-hour period. There are payments available if you're missing out on work because you are waiting for a test, or if you are missing out on work because you are a positive case and you don't have other entitlements to fall back on. All of that information is readily available, and many, many thousands of Victorians have drawn down on those test payments, the payments waiting for a test, and indeed the broader income support that both in the first instance our government provided, and then we've had the assistance of the Commonwealth for some time since. That principally relates to people who, if they don't work the shift, wouldn't get paid because they don't have sick leave to fall back on. In any event, all of that information, it's consistent with the CHO's orders. They don't need to be changed, but the Q&A documents will be updated to reflect that. So anyone who has any queries is able to go to the website and all of those can be answered pretty much in identical words to the ones I've just used, but any questions, of course, can be answered via the usual sources. I think that's all I needed to do in terms of updates of the day, but I will just finish before I throw to Martin to speak about a very important further funding announcement for alcohol and other drug services and mental health services. I'll just make the point that this is a day when all Victorians can see that this strategy is working. Because of your hard work, because of all the things you're doing and giving up, these numbers are coming down. And as they continue to fall, we will be able to find that COVID normal, because once you get the numbers low, you can keep them low. That's the experience, that's what we're aiming for, and that's what this strategy is fundamentally delivering. And it is a point of pride that Victorians, while staying apart, maintaining that social distance, are sticking together in the fight against this virus. We are winning this battle and we will prevail. It's just a matter of us staying the course, not letting our frustration get the better of us, not allowing our desperate hope and wish that this were over to lull us into a sense of pretending that it is. There's still a ways to go, but we are making very, very significant progress, and it's a credit to every Victorian who's playing a really important part in that.